Welcome to the Auburn Medical Group YouTube live stream, the entertaining medical live stream where viewers can ask real-time questions of real medical doctors. And here are our hosts, Dr. Mark Vaughn and Dr. Gwen Vaughn.
Welcome to the Auburn Medical Group live stream where we talk about urine.
Oh, is that what we're talking about?
Is that what we're talking about? So, just so that you know that he does know that we're talking about urine.
I do know that we're talking about that.
He already made his sample.
That's right.
He already
I
made
prepared.
his pee. I'm working on it. I drink.
Gosh, my eyes were floating all afternoon in anticipation. I was like, I got to be able to make some urine
really
for you.
clear, like you can like read something on the other side of it.
Look at that.
Yeah. So, these are urine dipsticks that we use for testing urine. We will be testing our urine.
We'll tell you what all those numbers and things mean.
We are so not cheapskates that we're each using our own cup and dipstick.
And we're not going to do the old-fashioned way.
No. This program does not spare any expense.
No, not at all.
When I get into the Auburn Medical Group's lab closet and take stuff downstairs. So that'll be interesting. We'll be talking about the different tests that we're looking at that are on the dipstick. But you know what we really need to get to?
Is an actual dipstick. Yeah. You dip it in.
Yeah, you dip it in the urine. Well, actually, when we have patients do it upstairs, there's a machine that this goes in the machine.
So we actually, which is kind of nice.
Has
it's all digital, so
sensor.
It takes away the,
prints out the results.
Yeah, the
the
variability.
of,
Variability you would get with the MA or nurse looking at it. So
comments. We do have comments.
It's working again. Hey, it wasn't working last time.
Yes,
we missed you last week because it was Labor Day.
So Darla Whitmer is saying hello. Hello, Darla. Thank you for joining us. We are glad to have you.
Welcome.
Join us on this program this week. We are really glad to have that. So we're going to be getting. I'm sorry, I'm not ready.
I know. We only have one sample right now because somebody was stage fright.
Is it still warm?
Do you want me to go turn on some water?
Let's turn on some water. Okay, let's look at.
This is a nice proportional to the size of our prostate.
So I took a picture of.
Oh, excellent!
Of the reader, so we can hold it.
Hold it up next to it.
I'll show them how we're going to do it. We're going to be holding the.
If you can turn it the other way.
If I can turn it.
Oh, it's one of those pictures that's not going to stay upright. I hate when that happens. And you got a nice little reflection.
So we have all the different colors. We're going to compare them.
We'll match it up.
And
you know what each one of those are? I mean, that's the thing. But do you know what?
Well, that's what the other picture's for.
Oh, okay, good.
See?
Oh, perfect. I thought that through.
I actually thought that through. Yeah. So we start with blood. Which one's blood? So it goes from this end to this end.
Right.
And it goes blood, urobilinogen, bilirubin, protein, nitrite, which is different from nitrate, ketones, that'd be explosive urine, wouldn't it? Ketones, ascorbic acid, glucose, pH, specific gravity, and leukocytes, which you read
after a certain amount of time.
60 seconds.
60 seconds, yeah.
The rest of them you read between 30 and 60 seconds. So you can see how this is going to be.
Timer here.
Yeah.
We're going to be on a clock.
Do I have... Oh, we have more comments. So before we start testing urine, maybe we could have somebody at home write down the results.
Any good
on yours.
Urine stories.
Urine stories.
How often do we do urine tests? Daily. I just had a
on
couple
your own?
done. Not on my... Yeah, well, you got to stay ahead of the game here.
Do you want them buying urine sticks?
I mean, in our office, yeah. You know, you stay on top of it.
Yatzy says, hello, doctors, and says, yep, the old dipsticks I had used every day. Yeah, you don't have to test your urine daily.
Yeah. They now have the home test
out there.
Yeah, they now have the home test where you can
do it
check
every day
to see if you have a infection, and it checks for other things as well.
So speaking of how often to check, how routinely should a patient have a urine dip?
Just a dip like this? Only when they have symptoms.
Only when they have symptoms, or there's some reason, something we're looking for.
Yeah.
Now, symptoms may not be urinary symptoms.
They may not.
Yeah, like looking for blood in somebody with abdominal pain.
Sure.
But actually, it is because of a urinary tract issue. Looking for glucose in
diabetic.
Somebody
usually we can do a finger poke.
Hyperglycemia.
Make sure.
pH in somebody you're concerned about acidosis or alkalosis.
Right.
So there's a lot of things that
besides just an infection.
Yeah, and sometimes again with abdominal pain, you'll see like elevated
bilirubin
or urobilinogen if they're not having bilirubin pass because of obstruction. So lots of stuff we can find on a very inexpensive in-office test.
Yeah.
For abdominal pain, metabolic disorders.
Dehydration. I wasn't thinking about that one, but dehydration.
Yeah. All right, and Darla also saying, I've, you know what? That's smaller than it used to be.
That is a little harder to read. What happened?
Yeah, what happened with that? Darla,
those are you reading this on your phone?
I've used the old lipsticks every day too. Still do.
The lipsticks.
Lipsticks.
Oh, very good.
Lipsticks.
Probably.
I don't like
autocorrect.
I don't like the thought of lipstick having anything to do
and urine
with
test.
Yeah, urinalysis. That's disturbing to me. Yahtzee, as a nurse. Okay. Not your own.
Oh, it all makes sense.
As a nurse, I worked in an internal med practice. We caught glucose, urinary tract infections, protein often. Yahtzee thinks we're funny. Crying, laughing so hard. Error, dipsticks. Thank you, Darla.
Gotta watch out for that.
Yeah, okay, I feel better. Thank you, Darla. We don't have to have that conference afterwards, so that's
those
good.
Lipsticks.
Do you think I should try? I don't know that I can.
That means I'm going to be left here on my own.
I'm trying to think.
And,
I haven't been drinking as much water as you have.
We don't need much.
I don't think I had any after lunch.
Oh.
Before this.
Am I going to win the clarity contest?
I
had one. Let's see.
I think
Can I calculate how much water?
Oh, I did once after lunch.
How many ounces of water have you had? I probably had
less
20,
than I should
40.
have. Less than I tell my viewers.
60. I probably had about 60 ounces of water a day.
60, not 16.
Yeah.
Let's see. This was 16, right?
Yeah, those are like
or 12.
I got that, and then I had some water with, or I had coffee this morning as well, which was probably about 10 ounces.
I probably had 20 ounces of water in the morning. Had that 12-ounce can of fizzy water. No, did I? Yeah, I did. I did upstairs and downstairs.
Didn't you this morning?
24. I had the mocha.
Some water there.
So that'd be So I've had at least 40 ounces.
Yeah, that's what I'm saying. Altogether, I'm probably at 60.
Yeah, but oh boy. Okay, I'll try.
That's it.
I don't know what you're going to do with
I'm going to tell stories about urine tests that are going to be amazing that you're going to miss out on.
Caffeine does not count, guys. It dehydrates you. She's saying that to me. I stuck my tongue out at you. Okay. Do you know what you're going to... Have you ever done the show by yourself? I mean, totally
no, I have
just
not.
You.
Yep.
Well, you'll have the...
Please
give him material so he doesn't stare at you with a blank face. Please, comments.
Until you come back, it's just going to be me sitting.
It's... He'll just be...
Well...
tapping his fingers or whatever.
No. I got stories.
And no, I'm not...
Urine stories?
I'm not carrying on the show while I do this in the studio. I'm going to the restroom.
Thank you. Yeah, I don't need to see that. Anyways, urine tests are something we do often. So naturally, I have some stories from tests that have been done. Back when I was writing my blog, I actually wrote a blog post on urinalysis stories and some of the funny things. First of all, I wanted to show off. I'll pick that up, put it back down. But look, I almost topped it off. But it's not a competition, especially you men out there. When we ask for a sample, you don't need to get it to the very top because the nurse does need to take this off and put it in. It's not pleasant when you splash it around a little. Of course, I'm wearing gloves and everything. But it's not a competition. Do not try to fill it to the top and then just slowly turn that on. You don't need that. Anyways, best story I have is when I was working at a community clinic up in Reading. Actually had a guy come in, had some urinary symptoms. I was like, all right, we got to get a sample. I was like, gave him the little cup, had him go in the bathroom, and I went and did something else. And I came back and he wasn't done yet. I was like, well, okay, maybe he's got a little, stage fright. Can't produce any urine. Gave him a little more time. And it took a while. And eventually he came out and produced his sample, or put his sample through the little, cubby thing, went back in the room, and I was like, oh, I saw that he was back, went and talked to the nurse, and then all the nurses were kind of snickering, talking to each other. They're like, you need to come see this sample. It wasn't a urine sample. Let's just say that. This guy produced a different type of sample. He thought that his birding, or what I had proposed that he should produce, was a different type of sample. So he was doing something else in the bathroom instead of just peeing in a cup. So that's probably the most outrageous story I have for a urine sample. I don't know if you have any. Comment if you have any outrageous urine sample stories. The interesting thing is urine can come in all sorts of colors.
Wow, you're doing it.
I'm pretty proud of this color. That's a nice straw color. Straw, clear, those are good colors. But anything besides that, I win. I don't know.
You did. You actually did.
Not that it's a competition or anything.
Yeah, it was a competition. That was the title of the show. That's a competition.
But you prepped me for it.
That looks horrible.
You prepped me for it, so I drank a bunch of water. So I had an
it was my idea. Look what
unfair advantage.
Oh my goodness.
I was talking about different colors that urine can come in. So this is like the classic urine color.
Yeah.
Yellow.
Yeah.
Apple juice.
Again.
But you can get the medications can change the color of your urine. Blood can change the color of your urine to red.
I'm really.
It can be really, really dark, much more dark than that. Like it could be orange.
Look how much darker it looks on the camera.
Yeah, that does make it look a little darker.
Than it does.
It almost looks like almost red on the camera. Man, that looks. Can you? I'm not touching you. Can you?
Yes. Let me see if I hold it up. I haven't adjusted color on that camera.
Oh, that's it. So mine looks overly.
White
You don't have anything white to put
hold
behind.
the Dutch Bros cup maybe. So
That's a lot
I
better,
don't know. Is that any
maybe.
better of a color?
I would say just from my look, it's like an apple juice color.
Okay. Really, it's not.
It doesn't look that dark.
It is not that red. Seriously.
I agree.
Thank you. It's not that.
Mine actually looks pretty close though.
Camera is really.
See behind it, see through it. Look at that.
Yeah,
my fingers behind it.
Can I see?
You can,
I see the
can see
dipstick
through it.
line. Yeah. Is
it dipstick time?
Can you? Well, here, let's do it like this. Can you see the dipstick through?
Yeah.
The urine.
You can see it.
There. Okay. Yeah. Let's each do our own.
Oh, we're gonna need a timer.
Oh, wait, I just got a.
That's the thing.
I just got a political text.
Or should we do it? Right.
Which party
Kevin
is it today?
Kiley back. Actually, aren't they not allowed to do that within a certain time frame of the
election? Well,
anyways.
Yeah, the election's months away, so.
Oh, I think that's for donations. This is for a poll.
Okay. I'm sorry.
All right, are you ready?
I'm trying to get the thing, but the text message is messing me up.
Do you need help using a phone?
Okay. There it is.
Oh.
Okay. The timer. Ready?
Timer. Oh, but then we got to compare it real quick for
Timer.
all of them except for.
Okay.
But which one is
a stopwatch?
Which one is leukocytes? That's the one we got to do. Okay. Anyways, I guess we'll figure that out.
Leukocytes is the bottom one.
Oh, okay. That's the one we got to do.
Should we smell each other's?
Whiff test.
You don't want mine. Mine is strong. I can tell you, mine is strong.
All right, ready?
All right.
Starting the timer.
Oh, you start from when you start
when you pull it out.
Yeah.
Right, just got to get it in there and pull it out.
And
got
then
it.
put it on the chucks to get the extra urine off of it.
Oh, I got to get it up there where yours is at.
Don't get confused.
Mine is the one in back.
We'll see if they show on the. There we go.
Oh, they're different already. Ooh,
they're different. Why are they different? Are your fingers wet?
No.
Okay. All right, let's take a look.
Mine is the one back. Has it been 30 seconds? It's been 30 seconds. Where's our reference? It's going to be 60 seconds by the time we.
All right, so.
Let's go up to negative for whatever the first one is.
The first one is
Blood.
Erythrocytes.
Blood. No blood.
Neither of us have any blood in our urine.
No blood. Next one, urobilinogen. They're both light. I would call that normal.
I would say yours is normal. Mine's probably like a 2.
Yours is like a 2. I would agree.
And then the next one is bilirubin.
Again, mine is.
Let's get these to
mine's lighter than yours.
We're gonna get to a difference here as we go down.
Mine seems like a lot wetter than yours. Try to get off some of that.
And then the next one is protein, and they're both negative. Yours?
Where's protein? Would mine have some greenness to it?
No, I'm sorry.
No, I don't think so.
I'm sorry. Protein's green.
That's.
It doesn't really look like that green. Okay, and then after protein is nitrite, which should be white.
It's not. It's not pink.
Yours is turning a little pinkish.
Yeah, I would not call that the pink thing.
Okay, the next one is ketones. They're both negative for ketones. And then the purple one is ascorbic acid.
Which is negative. We're both
Which is
purple.
negative for, we're not getting our vitamin C.
Lighter. That's the one that gets a little lighter
We should be getting vitamin C.
I should be peeing out vitamin C. I do not take any supplements.
Glucose is the next one. It's negative on both. And then this one that's different. Mine is orange, yours is brown. That's pH. My pH is 5, yours is 6. So I have a more acidic than you.
Mine's
and then
6.
Specific gravity, yours is a beautiful 1.005, whereas mine is.
I'm gonna go.
Whoa!
We're gonna have to go over to the other one.
All right, let's go to the other one. Mine is. They're not really able to see this.
1.0.
Can you see what we're looking at here? Oh, it flipped around when I did that.
1.025 maybe.
Wow.
I would say that. Or maybe 1.02. There's a little difference.
And then the bottom was leukocytes, which I think we can read now.
Both are negative. Yeah.
Because it's been 2 minutes 45 seconds. We've been dipping urine on YouTube.
There you go.
So
I do not have an infection.
And
am I pregnant?
And
Oh, we didn't test that.
Yeah, I didn't bring that. I really need to drink more water. Yeah, we went from specific gravity.
So that was a little different.
Can we give a definition for specific gravity?
We probably should. The amount of.
Siri.
Oh, ask Siri.
What is specific gravity? Oh, here's some information. It is the ratio of the density of a substance to the density of a given reference material. The reference is pure water.
Right.
So that's why if somebody has a urine with a specific gravity of 1.000,
above 1, yeah. That would be.
If you have one that's not above 1, we know that you're faking it.
It's straight urine or straight water.
That's water. That's not
water.
urine.
Yes. This is one of our.
Yours was
references.
1.05, right? Wasn't it 1.005?
Oh yeah, 1.0. You were right. 1.005.
1.005 was yours, whereas mine was 1.0025.
1.025.
Mine was 5 times as dense.
I guess that's how you would.
Is that right?
Interpret
Dense?
Yeah. Yeah, from all the matter inside.
The stuff that's not being diluted by water I should be drinking.
Things like that.
I've been such a bad example.
Drink more water.
I feel I failed you.
This is not the
live stream host.
Not a representative example of how I do. I would imagine I probably need to do better. Because this usually mine is a little darker.
You were trying
it
to
actually
prove
probably is more in this range. So I do need to drink water. Water is one of those things where I need to listen to my own advice a little better.
We so need to get caught up on comments and questions here.
Yes, we do.
We've
been chatting for a while.
They've been going crazy. So, and I have to read them here because I don't know why they're so tiny. I apologize to you at home trying to read these comments. I think urine dipsticks are not done often enough in medical practices. Yahtzee.
I agree so. I would agree with
get
that.
A midstream sample. Oh yeah, midstream. So speaking of midstream, I just didn't have enough. I mean, this is my whole amount.
Mine was midstream.
So it's instead of midstream, it's mid and end. But I did bring it in the stream after the very beginning.
Explains your wet fingers. All right.
Dehydration will make it darker. Yes, that's correct.
Yes, that is true.
Darla, I worked in a methadone clinic, and the patients would pay someone for their clean urine, so they keep getting their methadone or urine test on urine tests, which was once a month. But how how did they keep it warm?
Yeah, because we actually test
Because
the
we test the temperature, and if it's not
temperature
body temperature
on our medication,
we don't accept
refills.
it.
Yeah, exactly.
Yeah, so I wonder how unless maybe
Keep
you guys
it
weren't
right
doing
next
that.
to your body, even then it's going to cool down.
I cannot trust patients. Some lie. Well, Lindsay, I wish Dr. Terry were.
Oh yes, I remember that video
Oh yeah.
where he called them all.
He did
based
her
on
urine, too.
Taste. Oh,
She was in that video.
oh really?
For those of you who don't know,
I don't
Lindsay
remember.
was in a Dr. Terry
in
Bull
that.
video. She
Okay.
actually was.
I do remember.
I think it's
Yeah.
at a restaurant. She hands him a little cup of urine,
I don't.
and then he drinks it
Oh gosh. Yeah.
to test it. I wish Dr. Terry were here for this.
Man, those were.
He had a great trick for testing urine. So if you want to see that one, I'm sure urine is entitled Dr. Terry Bull, Terry
BUHL.
I think it was.
Yeah.
We'll have to put it, if I remember tomorrow or
Yeah.
maybe after the show, to put a link to that in the description for people
Our-
to watch this later.
Our late friend Larry.
Yeah.
He was a
Yeah.
great man.
Yeah, he was. So thank you, Lindsay, for remembering.
That's right.
The only person who's been on one of these videos who you've met in person.
Right. Yeah. We went over all those. Did we test? We kind of talked about what all them mean, right?
As we were going through,
yeah.
actually before I produced my
Right.
sample.
Yeah. And the big thing, I mean, people always talk about infection, and nitrates and leukocytes are kind of the big ones that that we look at for that. But like you said, it can be used in a bunch of other things too. Yeah, I think the ER mantra was any pain from the chest,
Nipples to
chest
knees.
to knees.
Nipples to knees. That's the
Get
rule.
a urine test.
Yeah.
Yeah.
Well, wait.
Because it can be very helpful.
Also, in anybody who is of menstruating age, get a pregnancy test.
Yeah. Right. Exactly.
That's just a mantra across the board.
Always. Yeah.
Either abdominal pain or pretty much for anything, because you have to be concerned about possible use of medications of pregnancy.
Right.
You never wanted to assume a person wasn't pregnant.
Yeah.
Before
give them something that may
before
be
prescribing or
teratogenic.
ordering teratogenic radiation.
Yeah.
Ordering
Right.
ionizing radiation tests. Extras. Okay, we also have Darla is saying here, I guess that they keep it against their body. They don't share that.
Yeah, probably not.
That'd be hard to keep at 98.6. You'd have to have like
Even then, yeah.
put it in the armpit or in the crotch
It
to
would
keep
be
it
hard.
warm, and then pull it out in the bathroom. Yeah, Yahtzee also says we had a little door in the bathroom that led to a secret door outside the bathroom to collect the samples. Then text in another room. It was then text in another room. Oh, test in another room probably.
Oh,
It was great. We also had the little door in the bathroom
little
for
cubby
passing.
pass through.
One door on one side, put the urine in, close the door, and then there's a door on the other side to open.
Right. With some mechanism so you can't open them at the same time.
Yeah.
And just like
the one in the staff bathroom.
Oh yeah, that one.
There's nothing keeping it
has
from
the
opening, but that's not for patients.
We don't use that one, yeah.
And then the one that the patients would actually use, the one that's across from the waiting room, has that fancy setup with the door that you have to lift up.
Oh yeah.
From your side to open your side. So yeah, no peekaboos going on. The door prevents that from
We're
occurring.
not spying on you.
No. Yahtzee realized it was tests that they wanted to say. So thank you.
Yeah.
That was a good show.
There you go.
Thank you for watching. I hope maybe you learned something about urine and health effects or significance of urine or the testing. And thank you for your comments and questions. Lindsay, of course, always thank you. Lindsay's name gets mentioned because she is so high on the Patreon level.
Right.
Because she supports.
And I was able to carry this show for at least 2 minutes while you were gone.
Yeah, you earned your Dutch
You have
Bros,
to watch
man.
that back and see what I talked about.
I think I heard it through. Did you hear when I flushed?
I did.
Yeah, because it's
Wonder-
right
wonder
on the
if
other side of that
wonder if
wall.
everybody else did. I don't know.
I'd like to know if our audience heard the flush. Yeah. Yahtzee loves our shows, and Darla, you shortly. I'm not sure you shortly. See you
I
shortly.
love your shows. You shortly.
You shortly.
You surely. You.
And Hilda. Oh, Hilda catches Hilda, do watch this one. It involves doctors producing urine samples. Here, I'll show you.
There it is.
And
There
the
is
significance of them, and you'll have to figure out which is which.
The evidence.
Who is dehydrated and not drinking enough water, even though he tells all the viewers
Do
to.
you see how supple my skin is?
He's talking about blood results. Oh, blood results. We'd have to draw our blood during the show.
Oh, I've had a lot of blood drawn lately. I can
you've
give you
had
all
that,
sorts of blood.
No, we don't want to take any more of your blood.
I don't need more. I don't need to give more. I probably need
But I
more.
also wanted to say that on Patreon, where Lindsay is, she has great status.
Great.
That also gets people information about my music stuff. I put that on there too. It's called,
Yeah.
the Patreon is called Videos by Mark Von MD. Videos and the music stuff too. It's
all tied
it's
in.
all in there. I'll post something here coming up of as I'm developing my next song. I'll put more on.
You told me
I'll
about
put
that.
more on the Patreon than I will on Instagram or anything else.
Cool.
Okay. Anything else?
I don't think so.
Okay.
Dink it and sink it.
Dink.
No, just kidding.
Until next time,
Hey, I'm Dr. Green.
Dr. Mark Vaughn telling you to stay in good health.
Doctors, thank you for another informative session. Auburn Medical Group is located in Auburn, California, USA. Thank you for participating. Please tell a friend and join us again next week.